everyone. Hi there. Hi, everyone. I am joining today. It's about 5 o'clock, 5:02 Eastern Standard Time. And I will wait on a few people to join. I tried to schedule this ahead of time. I probably could have done a little better with when I scheduled it, but this is meant to be a Q&A. I haven't done this in a while and really wanted to jump back on just to kind of share some updates, but also just to kind of keep it regular with the people that have been following for quite some time, really to just kind of answer any questions in real time that you may have. So I see a few of you joining. Thank you for joining. This is going to be a very informal Q&A. We'll probably spend about 30 minutes or so. Really just meant to have you guys ask me any questions. And this will be recorded as well. But I will wait for a few people to jump on. Um, we'll wait for a few people to jump on here. If you're on, if you want to just tell me where you're from and give me a thumbs up if you can hear me, that would be great. And we'll just wait for a few minutes here to allow other people to join. And if you are here, I'll jump right in here in a few minutes. But if you want to just, the way that I've done this before is just have you ask me any questions in the chat. The chat is also something that you can get back to with the recording. So if you'll just maybe put a question in the chat and I can try to answer it from there. But this is really meant to be pretty informal. It's just a way for me to try to engage with you guys. Thank you, Maureen. I see you here. But certainly, if you have any questions as we're waiting for others to join, I know this is kind of a funky time as well with people just getting off work. So certainly, if hopefully we'll have some more people join, but feel free to ask me any questions that you have. Um, since this is being recorded, I do want to spend a little bit of time. I have not been on here in a while for good reason, and I'm actually going to share some new news with you guys here shortly as well. But it's been a few months, so several months since I've been live, and I have tried to do these about every month or so. Um, Thank you so much. I've certainly missed being on here. But I've tried to do these at least once a month, at least leading up until the end of the year. Last year, I was able to really be successful with popping on at least once a month to do these Q&As. So I am very happy to be back and happy to kind of keep this going. The whole purpose of the Q&A is really what I've found over the years working as a PMHNP is that people have the same questions. And so I felt like it was a good idea to kind of get things going in one space so that I can answer questions and really just to kind of, engage with you guys a lot more. So that's the goal with these. But I'm going to be sharing some updates throughout. I see a few more people popping in. So if you're just joining, thank you for joining. Feel free to put any questions that you have for me in the chat. These questions can be anything that you want to know, whether you're pre-nursing, nursing, you may be a nursing student, you may be MSN, you may be a nurse practitioner, you may be an NP student. I have pretty much a spectrum of people here on this channel. So any questions that you may have for me, I will certainly do my best to answer them. And if I don't know the answer, I'll let you know that. But I also, you guys have kept me pretty intrigued and on my toes. So I will usually research the answer and try to get back to you if I can't answer it right away. But certainly put any questions that you have in here in the chat. It's meant to be very informal. And I want to spend some time first before we get into actually answering questions to thank you guys for joining and subscribing. I've actually gained quite a few subscribers in the past few months, although I haven't really been active on here. So I want to say thank you for that. You guys definitely keep me motivated to keep this channel going. And this channel was created for you guys as well. I mean, it's something that I decided to do a few videos here and there, and I think most of the information has been beneficial for most people here. So I'm very grateful that you guys have stayed on board. Um, I also have joined or actually talked with a few of you. And thanks for those that have reached out. Some of you have emailed me with very specific questions. I've actually met with a few of you as well. So that's actually been very interesting. Something I love to do just from a mentor perspective and just kind of continuing to help people, as they're going along their journeys. So if you ever want to email me or do anything like that, you can always look at the about section of this channel and it can tell you exactly what to do. Okay. Um, but I am going to go ahead and start answering some questions and then we'll get into a little bit more information about kind of some updates, things that I wanted to share with you guys that I'm seeing in real time in practice. But Maureen, thank you for your question. I think we have some people popping in and out here. But your first question is, what are your thoughts about NP residency programs or fellowship versus getting a full-time role right after PMHNP school? Um, I think this is a great question because it's not very common, at least as of now, for these fellowship programs to be really kind of up and around. At least in most states, I'm in North Carolina. We have a couple here that started a few years ago, but they're with larger hospital systems. So I will say that I think it can be very beneficial in the light of really just helping you to kind of gain traction on understanding the role and kind of transitioning from an RN to an NP. I think the real I guess test is when you actually graduate and get going. And you start to understand that there's a big gap between the roles of RN to NP. And I think most people struggle there. I don't think people struggle with the actual content and kind of knowing what to do. It's just adjusting to the role, that you've been used to being an RN. And then now you're kind of in this wearing a hat of provider and you're kind of making all these decisions. There is a transition and kind of a mindset that you have to shift with that. And I think having the NP residency programs around, it can really help you from that perspective. It also can help you with the support. When I say support, you may or may not be in a non-independent state where you can practice independently. But what I have found with these particular programs is that they do offer a great amount of support from usually an MD perspective or just kind of the clinical side of things. So let's say, for example, you may not have had the best clinical experience in school. These programs are really designed to help guide you as you're seeing patients. And I think they do a really good job, at least the one that I'm aware of here, with kind of matching up the didactic information with what you see in clinicals. So it can be very helpful. I don't think it's necessary to go through those programs. I think people do just fine without it. Although the learning curve may be a little bit steeper. Again, a lot of this has to do with transitioning that mindset from RN to NP. But I think it can be have very good value for you coming out of NP school, and really just having the level of support that you may want, you may need. Um, so that's really what I have to say about that. I don't think it should be mandatory. I don't think it's necessary for everyone. I think it just kind of depends on what you feel comfortable with. I think anyone can gain something from a residency program. And I think the most important part about that is getting the support that you'll need along the way. Yeah. So that was a long-winded answer, but thank you for that question. Hopefully that answered it for you. And you can let me know in the chat if you have other questions. I do see another question here. The best time frame to start studying for your boards? Um, Yes, you're welcome. You're welcome. So, just to touch on the boards a little bit, I've done a few videos kind of here and there about and touched on, the boards and, the things that you can expect with it. But I will say that, particularly for me, and most people kind of go along this path, is I actually, the study guide and the book that I used. I think I still have that somewhere here. But that was actually very helpful for me to get started. It's basically a book to start answering some questions and kind of getting going with things. I actually started that the semester before my last semester. And I think it's very helpful because usually with the way that most of these programs are set up, you are actually going to be doing all of your didactic work through about that second to last semester. And then the very last semester is set up for you to have more of just a practicum. So you're not going to really be doing a lot of didactic work for the last semester. And so for me, I found that very easy because I was able to kind of start studying for the boards. I started a little bit before the last semester, but I think I had more time and it was actually a little easier to do so because you don't have the load of the courses that you're trying to keep up with. And really, the things that you see in your clinical practicum, you're able to really kind of start matching things up. I will say you don't want to get into the habit of just really, doing things the way that it's done in practice because that can set you up for failure for the boards. You do want to go by exactly what you're supposed to be doing, but I will say that for me it was very helpful to kind of go alongside my practicum to be able to just start studying for the boards. And everyone's timeline is a little different for that, but I would say anywhere between 3 to 6 months is a good time frame to start studying. And then setting your exam once you actually graduate. For example, I graduated in May. I had already set to take my boards in June. So you want to, go ahead and start planning to set that up so that you have time to prepare if you want to reschedule. But it does also take a little time to get registered and everything like that. So studying is one thing, but then getting set up for the boards, I would recommend to go ahead and register for that as soon as you can. And in most cases, you can do that as long as you have the information from your school or your program. Okay. So hopefully that was helpful. I am going to get the name of this book that I have. Give me 1 second. Okay. So the book that I'm referring to is actually, I don't know if you can see this. It's called Review and Resource Manual. It's the Psychiatric Mental Health Nurse Practitioner, fourth edition. Um, and it's by Katherine Johnson and Don Vanderhoff. So you could probably Google that and find it. There may be a new edition for this now, but this is actually what I know from mentoring a few other NP students. This is what most of them also are using now. So again, there may be a newer edition, but this is the book that I'm referring to. Okay. I also took a review course. Now that we're talking about the boards, I did take a review course. Um, yes, it is the purple book. I believe it may be purple now. This is a fourth edition, so I think there's a new edition. But yes, I believe this is the same book that you're referring to. Okay. I took a review course as well, so those are usually pretty handy, and of course they can cost. There's another cost involved there, but you do want to, if you want to take a review course, you want to make sure that you're scheduling, a few months ahead, just to prepare for that. I took the Fitzgerald course, and I took the Barkley and Associates course prior to taking the boards. The Fitzgerald I've taken. I took this course as a review course, but the Barkley and Associates I actually took um, prior to me passing the exam. So those are also helpful. Those are kind of the major two out there, Fitzgerald and Barkley, that have courses for PMHNPs. Okay. So hopefully that was helpful for you, Maureen. Thank you for those questions. But feel free to ask me any more questions. And like I said, if you need to feel like anything's more specific or pretty individualized, you can always message me off the live. Okay. Um, we're waiting on other people to come on. I think this was probably not the best time to do a live because it's right around the time that most people are getting off, or if you're 12-hour shifts, you're still working as a nurse. So or maybe an NP. So we'll just wait a few more minutes for other people to come on. And certainly, if you have other questions, you can pop those there in the chat. But I wanted to also spend this time to talk through some updates and things that I've noticed as I have kind of continued working. And I've just continued, kind of, along my process of being a PMHNP. And one of the things I wanted to bring up today is, I've had some new NPs that have had difficulty finding jobs, and that's been a thing. I think that's more specific to geographical region. I don't think we're really at a point where the demand is, lowering, or we're kind of, catching up per se. I think a lot of this is based on geographical location. But I did want to share that one of the trends that I'm seeing right now, with PMHNP jobs and finding jobs. A lot of people, of course, are wanting telehealth, and I have my own thoughts about telehealth. I've done it for the past 3, 4 years. It's great. It has perks. It also has, downfalls in some cases. But for the most part, it's something that you can, manage and maintain as a PMHNP and do a really good job with your work. Um, the demand for that has increased. And so, what I'm finding, and I'm just sharing some updates that I've seen recently, is that there the requirements for these jobs have started to be more stringent. I'm seeing now that, obviously we may have more PMHNPs kind of in the workforce now. But I'm finding that the regulations and kind of some of the requirements for you to get these jobs is actually getting a little more stringent. And one of the things that I've seen with this is that we are now at a space where a lot of the companies are requiring that you are licensed in multiple states. And I find that pretty interesting because when I started telehealth back in 2020, 2021, that was not a requirement for these telehealth jobs. But I am now seeing a trend that you have to be licensed in, I think some of the job boards actually say 3 different states, others say 5. So just to allow yourselves to be more marketable and to keep us kind of in a space where we're not running into, situations where we have trouble finding jobs. I just wanted to give you guys that update, that I am seeing that as a trend now. And so if you are a new NP or you're a new grad or you're graduating soon, start thinking ahead about how to make yourself more marketable. And one of those things is actually being licensed in multiple states. So it's a thing now. We're here. And so I think we just have to kind of go with what is going to be required. But some states you have to actually be in the state of for the person that you're seeing, or the patient that you're seeing. Other states not so much. And so there's a lot of variability with that. But a lot of the telehealth companies have started to require you to be licensed in multiple states. So I just wanted to bring that up just so you guys know kind of what's ahead and maybe how you can prepare, particularly if you're one of those people, if you've had a hard time finding a job. I have had a couple of people that I've worked with recently that have had that issue. So thank you, Maureen. You said thanks for your great answers. How can we take advantage or maximize engagement in professional mental health organizations and conferences as PMHNP students or new grads? Yeah, great question. I think we can take advantage. I mean, we have, multiple organizations that we can be involved in. The ANCC is one of them. The benefit of the ANCC is they also have opportunities for you for like a preceptor bank, and you can start getting engaged there. If you're a member. But there's, a few ways that you can do that. I would say, I mean, there's obviously advantages of doing so in terms of partnerships and collaboration, and also just helping when it's time for you to continue your continuing education. There are lots of perks with being involved in these organizations. Um, Conferences, the other thing that you should keep in mind is as a PMHNP, regardless of your state, you are going to have these CEs and things like you had to have as a nurse. And so that does not go away. So I think the benefit of being a part of these organizations is, getting kind of evidence-based information, having access to those CEs, and continuing education opportunities, and then collaborating. I mean, the conferences, you can collaborate with other PMHNPs. I know I haven't been to any recent conferences, but I plan to attend a few over these next couple of years, at least try to make it to some of the bigger conferences. But the benefit there is also that can collaborate with other PMHNPs, whether it's for mentorship or, a lot of PMHNPs are collaborating to open their own practices. So I think it's goes without saying that there's lots of opportunities and perks in being a part of these organizations, from an evidence-based perspective, but the other side of it is collaboration with, colleagues. And I think that's always kind of been the case with these organizations, but certainly as a PMHNP, you may even find more value there. Okay. Yeah, great question. Thank you so much. My PMHNP journey, I've followed you as well, and so I appreciate you joining today. I know it's sort of an odd time for most people, but thanks for joining. Psych Congress, you went last year. It was very helpful, and that's one of the ones I am really trying to get to. I've heard great things about Psych Congress. I've not been able to make it thus far, but I do plan to very soon. So thank you for sharing that. So Maureen, that's one of the conferences that I have had multiple colleagues actually attend also, and they have nothing but great things to say about it. So thank you for sharing that, my PMHNP journey. Very, very helpful. Um, Maureen, you also asked a question, you made a statement. It's been a little bit of a challenge because employers are also asking for career experience. This is an issue for some new grads. Any recommendations or advice with this? Um, yeah, so obviously when you're applying for jobs, you've already gone through MP school, you're kind of on the backside of it where you may may or may not have the psych experience, right? And this is a part of what I was referring to with things being a little more competitive in addition to having those multiple licenses or being multi-licensed in different states. This is one of the things we're seeing as well. Um, I would say that you can always chalk up your clinical experience. Like if you get to a point of being able to get to an interview, you can always talk about those specific experiences. I've talked a lot about being an RN first and kind of being a psych RN and being at the bedside and how much value that can hold. And that's probably where some of these employers are able to kind of tease out, some of the people that are applying. But I do think there's a way around, you discussing kind of the experience that you do have and really chalking that up to, for them to get a good picture and understanding that you have had some experiences, you are comfortable working with this population. And from there you can kind of decide. But I wouldn't say that it's necessary to go back to a bedside RN role. In many cases, I mean, most people, what I'm finding is that they eventually find these jobs are good jobs. It's just that it may take a little longer. So if you're running into hiccups with that, I mean, you could also do like a PRN, some experience as a psych, bedside RN if you don't have any of that experience. But I think some of this is also being driven by, we've had some pop-up programs also that don't require a lot of experience ahead of time. And so I think the employers are really just kind of looking ahead and kind of looking for that. It doesn't mean you're less prepared. It means maybe that you may not have had as much experience, but I think if you get an opportunity to really talk about the experiences that you have had, I would maximize and kind of optimize those. And I know that doesn't help a whole lot because you're in hindsight, you haven't, maybe if you haven't done the psych bedside, you may not have as much experience, but really try to hone in on the experiences that you have had. And I think that will also help, just to get a better understanding that you may be a good fit and that you are comfortable working and competent with working with the population. Because ultimately that's what they're trying to get to. So hopefully that helps you some. And no problem with the questions. I actually that you've asked a lot of questions. I've had a few more people join in, so thank you guys for joining. This is being recorded, by the way, so you can always go back to this later. But this is really an informal Q&A. It's just meant for you guys to ask me any questions about the role, whether you're pre-nursing, nursing, an NP student, you're a nurse practitioner, maybe you're already practicing. But any questions that you guys have, please feel free to put those in the chat, those of you that have joined. And I've just shared a few updates that you guys can go back to as well. Things that I'm seeing where we've been talking a little bit about employment and kind of, I've worked with some recent new grads that have had a little more challenge finding jobs. So we've talked about some ways to make yourself more marketable. And what I'm seeing with that also, you guys can go back to that, is also just the requirement to be licensed in multiple states if you're looking for telehealth jobs. So that's definitely on the rise. Um, what other questions do you guys have? And I'm going to share a few more updates here as well. But any questions, please feel free to put those in the chat, and we can certainly talk through those in real time. I also want to invite you guys to follow my PMHNP Journey. He also has a great channel. We've spoken a few times just by the YouTube here, but also great information on his channel. But if you guys have any other questions, please feel free to put those in the chat. I'm going to share a few more updates as well. I have had a few of you reach out to me, and I've done. A lot of you have purchased the interview questions, psychiatric interview questions. So thank you guys for um, purchasing those questions. I have recently updated that document. I've just found a few little tweaks that I think would be more effective and efficient with, the psychiatric interview. So I have made modifications to that recently. And it feels like it's a better flow as I've worked with patients. You guys, I have come off of a job of working with patients. I've seen like 25 patients a day. And so I have gotten really used to the psychiatric interview over these past couple of years. And I've used that psychiatric interview questionnaire that I have. You can find that on the link on the About section here. But I've used it and I've modified it recently because the modification seemed to make it flow a little better. It is meant to be more conversational. A lot of times we struggle, particularly when you're starting out, with having a flow with your patients and not just kind of asking these robotic questions. So it's meant to really help you to be a little more conversational with your patients as well. But go check that out if you haven't. I also have recently, I've written an ebook, The Steps to Becoming a PMHNP. That is also on the About section. You guys, if you know anyone who really wants to know how to get to this point, or just having steps that you should follow, I have tried really hard to kind of compile a lot of the information from the videos that I've shared. And really just, it's a 21-page easy read that I've designed. It has a few additional tips for success, a lot of what I've shared with you guys as well. But feel free to, give that as a gift to someone, or, check it out. It's just really meant to kind of walk you guys through steps if you are particularly pre-nursing or a nursing student, or maybe you're a nurse and you're trying to decide, like, how do I get to this point of being a PMHNP, or maybe should I even consider it? Some of the tips for success that I've offered in there may be helpful to guide you along that journey. So thank you, Maureen, for that as well. Um, I have a few more questions here that I want to answer. I don't really want this to be too long, and then I'll share some final thoughts before we wrap up today. Um, you mentioned PMHNP Journey, that you made a lot of job networking contacts at the Congress Exhibitor Hall. So that's great to know. I'm really looking forward to joining the Psych Congress, is what we're talking about. It's one of the big conferences that a lot of PMHNPs attend. So thank you for that insight. You also mentioned that you're starting your second clinical rotation in the next month. Any advice in persuading your preceptor and letting you take more of a lead with patients? And absolutely, you're welcome for the compliment. Yeah, so I think at this point, I think what I would really kind of hone in on with your preceptor. Maybe it's someone that you've worked with, maybe not. That letting them know what your goals are ahead of time. And I think, this is where you can talk about your experience. I know your Psych NP journey, you have some experience. Since this is your second clinical rotation, I would start out by asking if we can kind of talk through what your goals are for the semester. And in many cases, I don't think many people steer away from letting you take the lead, because it's, less of a load for the preceptors. But people that really like to precept, they also really like to teach. And so the only way they can teach is by having you do some things so that they can understand kind of how you work. So I would start by just having a list of goals that you have for the semester. Um, Maybe even get as specific as the things that you want to work on and get better with, whether that's like psychiatric interviewing or diagnosing. And that way it's a good kind of foundation. And then just from there you can kind of use that as a segue to see if they will allow you to be able to kind of work with patients a little more closely so that you can try to achieve those goals. um, I think that's probably the best start. And maybe it's someone, like I said, that you've worked with that you may feel more comfortable doing that with. If you don't, I would just go in with a set of goals that you want to try to achieve. And really, when you do that, most people just kind of they get the gist that you're really into this, right? You're really motivated. And I think that's where they may feel more comfortable just kind of stepping back. You may get someone who feels like they're too busy to do that. That's also an issue that we can run into sometimes. But I would, personally start as, setting goals with the preceptor, and just seeing kind of how it goes from there. And I hope that that helps you some. But please let me know how that goes. I know sometimes the clinicals, you kind of have to take what you can get. um you're good friends with them, so you think it will work. Great. Yeah. And I recommend that with any of the clinicals, particularly your practicum as well. When you get to that point, just go ahead and have goals set for even places where you feel like you struggle a little bit or that you want to get better with. This is the time to do it. That you have someone kind of in the background helping to support you. But again, I think they'll also see the motivation that you have, and most people will feel pretty comfortable letting you take the lead. Yeah. So let me know how that goes. I'm very excited to hear about that. And like I said, I think it's good for you to do that, or for anyone to do that with any of the practicums or the clinical, your preceptorships. Okay, very good. Very good. I'm going to stay around for a few more minutes, for you guys to ask me any more questions. Thank you so much for those that have been engaged and involved. You've had great questions thus far. If you're just joining, feel free to put any comments or questions in the chat here. And I want to end before we get into more questions just by sharing some more information. Um, that's very exciting for me. You guys know I've been really kind of off the internet for a little bit, mostly because of some ups and downs, but also I have some really exciting news to share with you guys that I am going to be and have started my own practice. And so I have not started seeing patients yet. There's a soft launch that's going to happen in a couple of weeks. I'm now in the credentialing phase. And so I've been really busy with that. Just to be completely transparent. I think the last live, one of you actually asked me if I was going to be doing that, and I said no. That's maybe in the goals for the very near future, but really I wasn't too motivated to do much more at that point. Primarily because there's a lot of steps involved. It's a tedious process. But I honestly have had, and I'm going to share another video with you guys about what's driven me to actually open my practice now, sooner than I expected. But I've had, unfortunately, some bumps in the road with employers, and things that haven't really matched up with the way that I like to practice ethically. And that's really the guiding principle for me. And so I figured the best way for me to do it the way that I know that I can and that I feel comfortable with, that feels like it's serving patients in the best way, is to have my own practice. And so that is definitely what I'm working on, working through right now. But the good thing about this is you guys are meeting me now. And so I am going to be very transparent. I have been actually recording everything that I've done to get to this point, in terms of the steps that it takes to get to opening a private practice. Like I said, I'm in the middle of credentialing right now. I'm now credentialed with at least one insurance and a few others to follow. I am going to be taking insurance with the practice. And I will have the website's being really tweaked as we speak. So that should be up and running by the end of the week. But that's where I've been, just in case you guys have wondered. Things are going pretty well overall, but I've made some recent employment decisions, major decisions, and I'll share a video later to let you guys know exactly, what's prompted me to do this. And like I said, I will not gatekeep information. I will be sure to share with you guys exactly what I've done, as I've recorded the good, bad, and the ugly, with getting to this point. Okay. But anyone else with any questions that you have for me? This is really meant to be informal, but any more questions that you have, and this will be recorded in case you've just joined. So you can always go back. We've had some really good questions today, and I've shared a few updates as well. But any questions that you guys have, any last minute questions that you may have about the PMHNP role? And I'll just hang around here for another minute or so. But thanks so much for engaging with me here. And I think I have answered most of the questions. I think I had a little list of things to update you guys on. And I think I've shared most of that with you. So any other questions you guys have for me, and we'll give it another 30 seconds. If you're just joining, any questions, you can put those in the chat, and you can always get back to this video later. My PMHNP journey, I appreciate your support and kind of ongoing collaboration and just kind of chatting here and there. And again, Maureen, I thank you for your questions as well. You've had some great ones today. Okay. All right. Well, no other questions, it looks like. So we're now at about almost 38 minutes. So I don't want this to be too long here. I will plan to do another one of these probably roughly in a month or so. I will be doing a couple more videos just to kind of keep you guys abreast of what I'm into right now. But otherwise, hopefully this was helpful, and I hope you guys have a good evening. Thanks.